Aaron, this is a continuous passive motion machine, or a CPM. After certain procedures, your doctor may prescribe this particular machine. And so what it does is bend and straighten your leg, and you control how much that bending and straightening goes. So what we're going to do today is fit the machine to the length of your leg, have you get in the machine, and then I'll show you how to control the machine. What we're going to do first is fit the machine to your leg. So we're going to use your left leg. And what we're going to do is lock the machine down so that you won't have to play with it after I'm all done.
Okay.
If you would for me, just give me a little help. I'm going to lift your leg. We're going to go up and in the machine. Great, just relax your leg as much as you can. And what you're looking to do is line up the kneecap or the knee joint with the machine. So if you can look over to the left, you see the white knob over here. We're trying to line that up with your kneecap so that everything is bending as one. Relax your foot and let it slide down into the pocket. Great. Just going to adjust the length of your thigh. Is your foot comfortable?
Yep.
The other thing to make sure of is anytime you get in the machine, as well as making sure your kneecap lines up, that your foot is always touching the plate from here on in as well. That way you'll know that you're lined up correctly and you're in it properly. There's one strap on the machine that goes just below your knee. So if you look at your incision on your knee, you want to go just below that so it's not touching your incision. Nice and loosely strap that guy down. And then what you want to do is there's one strap that goes over your foot as well. Come over your foot and grab the Velcro on the other side. The machine right now is set at 30 degrees of flexion or bend of your knee. So anytime you get out of the machine or get back into the machine, stop the machine at 30 degrees. That way, when you get your leg back onto the machine, when you put it in at 30 degrees, you'll know you're in it correctly because your knee will bend to that angle. So again, make sure you're lined up correctly there and down. Now on the CPM controller device, I'm going to show you how to set flexion and extension. Again, flexion is how far you can bend your knee, and extension is how much you straighten your knee. You want to always go by what the physician tells you to do, and the technician that comes out to your house will certainly inform you as to what parameters to set the controller at. But just some basic things about the controller so that you can play with it as the physician prescribed. What you want to do is anytime you want to control how much you bend or flex, you want to hold down that key that says flex or F-L-E-X. So if you hold that down and then hit either one of the arrows up to increase the number of flexion, the down arrow obviously to decrease the number of the flexion. The higher the number of flexion, the higher your knee will bend. Similarly, the extension, if you hit that button and simultaneously hit one of the up or down arrows, you'll go up or down with extension as well. If you release that button, everything is locked in the machine. Of course, the big red stop and start button will get you moving and stopping. If I go ahead and hit that, it will say run, and you'll go in between the extension and flexion with your numbers. So the machine is moving right now down to -5, and then it'll go back up to 30 degrees. If at any point in time the machine does not feel good or it's hurting you, you can always hit the stop key and it'll say stop, and then what you would want to do is start it again if you're too far bent, and that will put it in the reverse direction so you can get out of that uncomfortable position. There's a little clip on the top, and what you would want to do is make sure that's clipped to either your bed or your clothing, so that if the machine, the handheld controller gets loose from you, it's not dropped on the floor and then you can't get to the controller to stop the machine. So again, anytime you get in and out of the machine, you always want to keep it at 30 degrees even if the flexion is higher than 30 degrees. So you would want to make sure that the machine is stopped and started at the 30-degree mark so that you're in it correctly. And a technician will always, again, be out at your house initially to set you up on the machine as your physician prescribed, and can answer any of the questions at the time of your fitting.